Hi, this is Dr. Reynaldo O. Joson, Director of the ROJoson PEP Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in Development of Thyroid Cancer, which is part of the cancer course. Definition of terms in the title and the limitation of coverage of my talk. Fundamentals mean simplest and essential facts and theories which can serve as a basis or foundation and support for advanced information. Generalities are general statements of information and not covering specifics and not too detailed. Development of thyroid cancer means appearance and growth of thyroid cancer. The contents will be the following: what is a thyroid cancer, how common, what are the different types, what are the possible and theorized causes, can thyroid cancer be prevented, who are at higher risk, what are the behaviors of thyroid cancers, how does thyroid cancer kill the patient, is thyroid cancer curable? Let's start with what is a thyroid cancer. Thyroid cancer is a medical disease when some of the thyroid cells grow uncontrollably with a potential to invade the adjacent body tissues or organs and to spread to distant tissues or organs. The thyroid cancer presents as a solid tumor and not as a liquid tumor. It is also known as thyroid malignancy or malignant tumor of the thyroid. To differentiate it from benign tumor of the thyroid, which does not invade or spread. So a benign thyroid tumor, in contrast to malignant tumor, is one that does not invade or spread. How common is thyroid cancer? Thyroid cancer ranks number 7 in the overall cancer cases in the Philippines, more common in females than in males. It comprises 1% of all cancers. This is the most common among the endocrine gland malignancies. Endocrine gland means those producing hormones like the adrenals, pancreas, and parathyroid glands. About 90% of all thyroid nodules are benign or not cancer. What are the different types of thyroid cancer? Not all thyroid cancers are the same. It is important to know the specific type as this affects decisions on the treatment and prognosis. The more common types of thyroid cancers are papillary, about 90%, follicular carcinoma, about 10%, anaplastic carcinoma, about 1%, medullary carcinoma, less than 1% in the Philippines. Others, like lymphoma, squamous cell carcinoma, very, very rare. So the origin of the thyroid cancers will be from the C cells or medullary cancer, and from the follicular cell, the papillary, follicular, and anaplastic carcinoma. What are the possible causes and theorized causes of thyroid cancer? Up to now, and most of the time, about 90 to 95% of the time, nobody knows the exact cause of thyroid cancer developing in the patient, as most of the time, the cause is multifactorial. Only 5 to 10% of thyroid cancers are due to inherited gene mutation from the parents. So 90 to 95% are sporadic cases. There's a higher incidence of hereditary as a cause for medullary thyroid cancer, but this cancer is very rare in the Philippines. All diseases, including thyroid cancers, have underlying, antecedent, and immediate causes. All diseases have predisposing, precipitating, and perpetuating factors. However, it is difficult to pinpoint the exact cause as a single cause at that, as oftentimes the cause is multifactorial. So at best, we can only theorize the possible causes and factors. For a patient with a thyroid cancer, an example in the analysis of the theorized causation for the development of cancer could be as follows. Genetic predisposition could be an underlying cause. Long-term unhealthy lifestyle could be the antecedent cause or precipitating and perpetuating factor. And genetic mutation will be the immediate cause. Another scenario, genetic predisposition could be an underlying cause. Excessive exposure to radiation could be the antecedent cause or precipitating and perpetuating factor. And gene mutation is the immediate cause. Another scenario, no genetic predisposition, but the underlying cause may be from chemicals, which now also becomes the antecedent cause or precipitating or perpetuating factor, and gene mutation is the immediate cause. So at the present state of knowledge for the sporadic cases, not the inherited gene mutations from parents, it seems that the last and ultimate and proximate cause of cancer is changes from mutations to the DNA within the cells, which is the gene. And thus one can say that thyroid cancer is a genetic disease, that is, it is caused by changes to the genes that control the way our cells function, especially how they grow and divide. The three most common theorized ways in which a gene mutation can instruct a healthy cell to form cancer are the following. It allows rapid growth. The oncogene or a gene mutation can tell a cell to grow and divide more rapidly. This creates many new cells that all have the same mutation. 2, failure to stop uncontrolled cell growth. Normal cells know when to stop growing so that you have just the right number of each type of cell. Cancer cells lose controls that tells them when to stop growing. A mutation in the tumor suppressor gene allows the cancer cells to continue growing and accumulating. Lastly, makes mistake when repairing DNA errors. DNA repair genes look for errors in the cell's DNA to make correction. A mutation in the DNA repair gene may mean that the other errors are not corrected, leading cells to become cancerous. What causes gene mutations? What are the underlying and antecedent and immediate causes? And what are the predisposing, precipitating, and perpetuating factors? Gene mutations can occur for several reasons. For instance, gene mutations you're born with, you may be born with a gene mutation that you inherited from your parents. This type of mutation, though, accounts only for a small percentage of cancers. This can be the underlying or predisposing cause. Gene mutations that occur after birth. Most gene mutations occur after you're born and are not inherited. A number of factors can cause gene mutations, such as smoking, radiation, viruses, cancer-causing chemicals or carcinogens, hormones, chronic inflammation, etc. So this could constitute the antecedent, precipitating, and perpetuating cause. Most notorious of the environmental factors causing gene mutation, particularly for thyroid cancer, is radiation exposure. This increased the risk for papillary and follicular thyroid cancers. Radiation history leading to thyroid cancer. One possible scenario is the patient received low dose to moderate dose of X-ray treatment, and this was used before 1950 to treat children with acne, tonsillitis, and other head and neck problems. radiation therapy for Hodgkin lymphoma and other forms of lymphoma in the head and neck, exposure to radioactive iodine, also called RAI or iodine-131, especially in childhood, and lastly, exposure to ionizing radiation, including radioactive fallout from atomic weapons testing during the 1950s and 1960s, and nuclear power plant fallout. Examples include the 1986 Chernobyl nuclear power plant accident in Russia and the 2011 earthquake that damaged nuclear power plants in Fukushima, Japan. Another source is the environmental release of iodine-131 from atomic weapon production plants. The gene mutations you're born with and those you acquired throughout your life work together to cause cancer. Can thyroid cancer be prevented? Yes, but not all, not 100% preventable. Thyroid cancers develop through multiple factors such as genetic predisposition and environmental factors that it is difficult to identify a sure shot specific strategy of prevention, except for minimizing radiation exposure as much as possible. There are some things that can increase the risk of cancer, thyroid cancer, that we cannot change. These include things like damaged DNA inherited from a parent, family history, and getting radiation because of need for treatment for another disease. Though managing certain controllable risk factors can lower your chances of developing cancers, there's no guarantee, so just best effort. So who are at the higher risk for developing thyroid cancer? The exact specific cause of thyroid cancer developing in a particular patient is difficult to pinpoint. For a preventive program against thyroid cancer, we must know the risk factors, know the controllable ones, and then control and mitigate them. Risk factors, if present, can affect your chances of getting a thyroid cancer, but having a risk factors does not mean that you are guaranteed to get it. Again, to emphasize, though managing certain controllable risk factors can lower your chances of developing thyroid cancers, there's no guarantee. Best effort. These are some of the uncontrollable risk factors: being a female, family history of thyroid cancer, inherited thyroid cancer genes from parents, the need for radiation for treatment for another cancer. Controllable risk factors, the most common is exposing to excessive radiation, particularly to the neck. As much as possible, minimize this. So cancer prevention, mitigation tips on controllable risk factors: avoid excessive radiation exposure, especially to the neck. Be in touch with reliable medical information on thyroid cancer risk and prevention. What are the behaviors of thyroid cancer? Once a thyroid cancer develops, it has the potential to grow and invade or infiltrate adjacent organs or tissues, and also the potential to spread to distant sites in the body. The rate of growth and spread of the cancer is dependent primarily on the behavior of the mutated gene and secondarily on the presence of promoting factors in the person's body and in the environment, like cancer-causing chemicals. The thyroid cancer that has spread to another place in the body is called a metastatic cancer. The process by which cancer cells spread to other parts of the body is called metastasis. Metastatic cancer has the same name and same type of cancer cells as the original or primary cancer. For example, a thyroid cancer that forms a metastatic tumor in the lungs is metastatic thyroid cancer and not lung cancer. The behavior of the common types of thyroid cancers, which are papillary, follicular, anaplastic cancers. Okay, these are the more common. Papillary and follicular thyroid cancers are usually slow growing and the prognosis is good. Anaplastic cancers, usually fast growing with predisposition to invasion and spread to distant areas. Prognosis is very, very poor, and this usually occur in older people. Papillary thyroid cancers usually spread via lymph the channels, whereas follicular thyroid cancers usually spread via the blood channels. And the most common sites of metastasis are the bones and the lungs. How does a thyroid cancer kill a patient? Thyroid cancer can directly kill a patient when it invades the airway to the point of asphyxiation, because the thyroid is located near the neck, in the neck, and it can spread or metastasize to essential organs like lungs, bones, liver, and brain, and stops them from functioning properly. Thyroid cancer can directly kill a patient secondarily or indirectly through complications during surgery, complications and other forms of treatment such as chemotherapy, infection due to compromised immune system, and malnutrition. Is thyroid cancer curable? Before I answer this question, let's have a definition of medical cure. The conventional definition of medical cure is medical condition that's completely gone and will never come back. For example, if you have appendicitis and doctors remove your appendix, you have been cured. If you have gallstones and doctors remove your gallbladder with stones, you have been cured of the problem. For thyroid cancer, especially papillary and follicular ones, there are patients who after treatment do not have their cancers coming back 10 to 15 years or even longer. So strictly speaking, they can be considered cured. However, doctors do not want to categorically use the word cure for them. They use the word in or the phrase in remission. Why doctors do not guarantee cure for cancer? One, doctors don't know everything yet about thyroid cancer as a disease. The best knowledge so far is that the ultimate and proximate cause of cancer is damage or changes to the gene within the cells, and that the cancer is a genetic disease caused by changes to the gene that control the way our cells function, especially how they grow and divide. There are several theories that I've mentioned earlier. The exact mechanism is not yet definitely known. Thus, even the presence of targeted cancer therapy on molecular or gene level at the moment, up to the moment, are not yet 100% successful. The usual cancer treatment modalities like surgery, chemotherapy, radiotherapy are strictly not treating the primary cause of the cancer. They just extirpate, kill with the drugs, and burn the cancer. If the primary cause is still around, there's always the possibility of recurrence after treatment. No two cancers are the same. Each individual cancer possesses different biological characteristics. Even cancers of the same type and the same extent. Some are slow growing while some are fast growing. Usually the biologic behavior of the cancer is not known at the time of treatment. Thus, the only time will tell the outcome of the treatment. After treatment, some cancer cells may remain somewhere in the body unnoticed, and patients are asymptomatic for a long period of time, even as long as 10 years or even longer, but can eventually grow and divide, invade, and spread to distant areas and become a nuisance. This is what is called a recurrence. So at the time that there are no symptoms of cancer, doctors use the word remission. They do not guarantee completely no more cancer. Some cancer cells may be present but unnoticed. Complete remission means that the tests, physical exams, and scans show that all signs of your cancer are gone. Some doctors also refer to complete remission as no evidence of disease or no evidence of recurrence. Complete remission does not mean cure. Recurrence. Some cancer cells can remain unnoticed in the body after years of treatment. If a cancer returns after it has been in remission, it's called a recurrence. A cancer can recur in the same area as in the neck. It was originally diagnosed, or it can recur in the different parts of the body like the bone or the lungs. So up to now, strictly speaking, there is no true cure for cancer. Not only for thyroid cancer, but for all cancer, no guarantee it will not cure. Physicians do not talk of cure. They use the word remission if there are no signs of recurrence, but they, together with the patients, always hope for a cure, especially for those cancers which are recognized, diagnosed, and treated early, and with a known track record of slow growth in behavior. To boost the morale of the thyroid cancer patients, though, one may say that the patient is cured already if there is no recurrence after 10 years or more. However, there's always an exception to this. Long remission is usually seen in patients diagnosed and treated early. A summary, conclusions, takeaway. I have expound on this. What is thyroid cancer? How common? What are the different types? What are the possible theorized causes? Can thyroid cancer be prevented? Who are at higher risk? What are the behaviors? How does thyroid cancer kill a patient? Is thyroid cancer curable? Take away in relation to patient empowerment. Be always in touch with reliable medical information on fundamentals and generalities in thyroid cancer development. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to prevent thyroid cancer, and in case it is not prevented, to gain greater control over decisions in the management. With that, I end my pep talk, fundamentals and generalities in thyroid cancer development. I hope I have empowered you to have a better understanding of the fundamentals and generalities in the development of thyroid cancer as a health disorder or medical disease. For this, I thank you for your kind attention. Good day, mabuhay kayong lahat.